I'm Tami Curtis, and I'm the Health and Wellness Coordinator for Washington County School District in St. George. I love working with kids and communities. I really think if we want to change the world, we have to start with the children, and that's where we have the opportunity to work with kids in schools. So many of my own clients, when I was doing clinical social work, would say, why am I just learning this now? We need to learn this in schools. And in this modern world, things aren't getting easier on kids. It's only getting tougher. Our kids just have so much more to navigate in this modern world, and they need more skills to be able to do that. I think that's a favorite part of my job, is just being able to empower kids with skills, and in doing so, also empowering adults, because we didn't learn this in schools. And what a great opportunity to be able to provide that in an environment that's safe. They're already learning, and we just expand that learning to the skills that really help us to be able to make the best of our lives. I was always interested in this field. I really liked psychology. I really liked thinking of counseling and therapy. So in my undergrad, I did an internship at the high school in a counseling center. And unfortunately, the year before I started, or the summer before I started, we had a suicide, a student. And so it really changed the trajectory of our work that year. And we met with a lot of students, and it wasn't just scheduling, it wasn't just advising, it was really meeting with students and talking about what was difficult for them. And I just fell in love with that work. And that's what ultimately made my decision at that point in time is, what's next? What am I going to pursue for my graduate? And it was social work. I didn't realize how many options I would ultimately have and serve in. So I feel like I've had a lot of varied experiences. I've worked in residential treatment with young girls with eating disorders. I've worked in residential treatment for people with substance addiction. I've also worked in inpatient behavioral health in the hospital and doing crisis work in the emergency department. So many different populations, and then doing outpatient clinical therapy and intensive outpatient clinical therapy. I've also worked in the behavior field, so I worked with people with disabilities for many years, also writing behavior plans, and then schools. And again, I think I said it earlier, if we really want to change the world, we have to start with the children. And I think for me, it was really focusing on those kids that we lose. There's a gap in our system. So really focusing on how do we close that gap? One of the things that I think is important to recognize is that often, there's a challenge that we're all trying to meet. And sometimes our skill set isn't quite where it needs to be to meet that challenge. And maybe sometimes our skill is actually above that challenge. And for kiddos, if their skill set is above, they're going to be bored, and that's not going to be helpful. Or if they're below, they're going to be stressed and overwhelmed. And so we can do so much as adults to close that gap and really help support them so they can really succeed at that challenge. I'm Tami Curtis, and I'm proud to be a social worker.